So welcome everybody. Thanks for joining. We wanted to take some time and consider the current live consultation that the Great London Authority is doing around a key worker living rent product. Obviously, that crosses over with the Homes for NHS Staff agenda, but we're also conscious that key worker living more widely still does have a benefit for the health and care system. So I think that's always worth noting in and of itself. And very kindly, Deborah Halling from the GLA's Housing and Land Policy team, who's working on that consultation, is coming today to talk to us about the idea behind it and the principles. And there's a number of questions that the GLA also has for kind of consultees and stakeholders and partners around what's been presented so far. So, and there's a number of questions there that obviously I think there's an opportunity for people to think about and to respond on. There'll be one or some responses to that consultation from the health and care system. I know that Sarah from the NHS Homes Alliance is keen to do something on that. I recently spoke to John Considine from the Royal College of Nursing. I think they're keen to review and respond to, and we've been talking about potentially doing a centralised NHS London system response through the Healthy Urban Development Unit, and Mary Manuel's here today. So we'll talk again at the end and maybe share some contacts for people who want to make other points. We're recording the session today, so we'll also try to kind of amalgamate some of the questions and comments that people make to think about how that can help inform the response. And hopefully for Deborah, she will also be able to access this to remind herself of what the things that people said during the session. So without any further ado, I will introduce Deborah Halling from the GLA to come and talk about the consultation, and there'll be time for questions and things. Well, Deborah can decide if she wants to do that during or afterwards. Thanks.
Thanks, Richard. Yeah, if only because the prospect of speaking for the entire time is quite exhausting, and definitely keen to have time for questions and discussion and generally a chance to hear what you're thinking. So I'm part of the policy team in the Housing and Land Directorate at the GLA. I have been working on the consultation on key worker living rent homes, which I am going to talk about shortly. I'm keen just that my colleague Rachel, who I think is on the call, introduce herself. And I'm also just sorry about this kind of very not backstage housekeeping stuff, but Richard, I have just sent you my slides. I don't know if you're able to.
Deborah, you should be able to present if you want to.
Yes. Okay. I can try doing that. How about Rachel? Rachel introduces herself, and I will just see if I can get my slides accessible.
Great. Hi, I'm Rachel Remedios. I also work in the Housing and Land Policy team with Deborah, and I'm supporting Deborah with this project. I'm particularly interested in the kind of equalities impact of these proposals. So if anyone has any comments about particular groups that they think will either benefit or might be disadvantaged by these proposals, then I'm really keen to hear them. And I will also be taking lots of notes in general on any questions and comments that you have. So rest assured, yeah, we'll have a note of those.
Right, I am just going to attempt to share my slides. It's always a nerve-wracking moment in these meetings, despite years now of doing these meetings online. How is that looking? Yeah, you can see slides. That's good. Okay. Great. We'll see how we get on with the slides then. So some of you may remember that back last spring there was a mayoral election campaign going on that have obviously been several other election campaigns since then, so that may seem like a very distant memory. But Sadiq Khan was campaigning to be re-elected as mayor. One of the commitments in his manifesto, which you can hopefully see on that slide, is that he was committed to building new rent control homes, which we'll see, I'm quoting here, we'll see rents capped and linked to the incomes of key workers. And he committed to there being an initial phase of 6,000 of those homes across London. And then kind of moving on in time to last November, the mayor had by then developed proposals for key worker living rent homes as a form of the rent control homes that he had promised in his manifesto to deliver. And he launched a consultation on those proposals, as Richard mentioned, back in late November. And that has got another month to run until the 3rd of March this year. We normally run consultations for 12 weeks, but we extended this one slightly in recognition of the fact that people might have been otherwise, hopefully were in fact otherwise occupied over the Christmas period. I will stick the link to the consultation in the chat in a bit. They're actually just looking, I think Richard has already very helpfully done that. So the consultation document is on the page that Richard has put a link to in the chat. And the consultation is kind of publicly available. Although I think it's fair to say that the mayor is particularly keen to hear from key workers who need homes they can afford, from institutions that employ them, which obviously a wealth of on this call, and organisations that represent them, including unions and professional bodies. And I know Richard mentioned some contact that we've had with the Royal College of Nursing, and we've also contacted a range of other unions and professional bodies. The mayor is also keen to hear from housing providers and developers, with whom he'll need to work to develop these homes, and from organisations that represent them too. And that sort of includes registered providers, so housing associations and councils, and also market developers and providers. And then the mayor's keen as well to hear from local planning authorities, so making decisions on what homes get developed, and from the planning consultants who work with them. And the responses that the mayor gets to this consultation will inform his final plans for key worker living rent homes, which we are hoping to publish early in the next financial year. And he's really aware that in order to kind of get 6,000 of these homes and to make sure they make a difference to those for whom they're intended, it's really important to have kind of insights from those with experience of delivering homes and seeking to deliver homes for a group the mayor's referring to as Londoners on ordinary incomes, including key workers. So really keen to hear from people and organisations represented on this call in response to this consultation, and hoping to kind of give you a nudge in this direction. As I've mentioned, there will be plenty of time for questions and comments, and Rachel and I will kind of note down things that you say today, and we'll also sort of feed that into the mix of consultation responses. But please do respond if you can in writing as well to the consultation. So just moving on, you're now on a slide that says key worker living rent homes, what the consultation covers? Yeah. Just checking, you can see the same thing that I think you can see. So these are the areas that the consultation covers. And what I'll aim to do today is just give you a bit of a sense of what the kind of key issues and the questions the mayor is asking in relation to each of those areas are. So just to kind of try and give a bit of a sense of where these homes are likely to sit in the landscape of affordable housing in London, and the mayor's kind of rationale for this proposal. His intention is that they're intermediate homes, and specifically intermediate homes for rent. And the mayor's clear in the proposals he's consulting on and elsewhere that that isn't intended to be an alternative to social rented homes, but they'll sit alongside them and be for households who are unlikely in the current kind of context to get social rented homes, but who are struggling potentially to pay private rent, excuse me, after really sort of steep increases in recent years, and that sort of being a situation which is detrimental to those Londoners, but also to the services that are seeking to recruit and retain them. And in particular, the Mayor's intention is that these are homes for key workers. Now, that in lots of ways isn't really a kind of new thing. So I'm sure those of you on this call are well aware that the Mayor has been encouraging local authorities and housing providers to prioritise key workers for several years now. So he first began to do that in 2020 in the kind of context of the pandemic, which was he highlighted how essential key workers were. And he encourages boroughs and housing providers to prioritise key workers using a list of key worker occupations that he published back in 2021. And yeah, his intention is that by these homes going to Londoners on that list, that will help with the recruitment and retention challenges that essential services are facing. And then another, I think, key point is that these homes are different from shared ownership and London living rent homes, which are the types of intermediate home that the Mayor's London plan says he prefers, and also other two tenures that he has funded through his current affordable homes programme. And the difference is that they're for long-term rent rather than providing a kind of a pathway or a route to shared ownership. And in that respect, the Mayor is kind of hoping that they might be suitable for households for whom home ownership isn't a kind of option that they want to pursue at the moment. And that might be for financial reasons, but it might be because, for example, they only anticipate being in London for a few years, or because of kind of the makeup of their household. And then in terms of differences between these homes and shared ownership and London living rent homes, there's a bit of a different approach, which I'll say more about shortly, to rent setting and rent increases. And the Mayor's intention is that those things are simpler than for London living rent homes, and that gives potential investors and developers and providers more kind of confidence in working out what the long-term rental yield from these homes will be, and basically then means that more of them will be delivered because providers feel more confident about what income they'll get long term. So the next area, after that sort of background and rationale, the next area the consultation covers is the planning framework. And it makes clear that the Mayor's assessment is that these homes, as he's proposing them, meet the criteria for intermediate housing in the National Planning Policy Framework and in the London Plan. And set out there some of the criteria in the London Plan. There is an income threshold, which is currently £67,000, and households have to have incomes no higher than that in order to be eligible for intermediate rent. The Mayor also says that planning authorities should ensure that homes are being developed that are affordable to households with a range of incomes below that level. And he says too that the homes shouldn't cost any more than 40% of the net income at which the threshold is set. And sorry, that's kind of a slightly bit of a mouthful. But at the moment, that means housing costs shouldn't exceed £1,563 a month. So there's a kind of a basic framework there for developing these homes, but the Mayor also appreciates it might be helpful to getting these homes developed, both from the perspective of potential developers and also planning authorities, to set out some more detail in the planning documents for London that the Mayor produces. He's intending to add something to some forthcoming planning guidance on affordable housing, and there's an option potentially of including it in a new London plan. Probably many of you are aware that developing a new London plan is a very long and complex process, but that is an option which he asked about in the consultation. So just moving on to eligibility and allocation, which I guess is a sort of area of particular interest to this group. I mentioned the income thresholds for intermediate rented homes, which would apply to these homes. And the Mayor's intention is that these homes will go to key workers by virtue of the kind of current policy framework that encourages boroughs and providers to prioritise key workers for intermediate housing, something that I've already mentioned. But he's also contemplating that if he were to provide funding to registered providers to develop these homes, he could set a slightly stronger requirement. So this home must go to a key worker. And that's something that he asks about in the consultation. And he also, in the consultation, says that he is really keen to work with organisations that are seeking to secure homes for key workers, well represented here, obviously. And he asks for kind of insights on how you might best work with them to deliver these homes for the groups that they're seeking to assist. And hopefully that's something we can kind of come back to in questions and discussion. But I'll just briefly run through a few points about the potential kind of cost of these homes. So there are some proposals for rent levels in the consultation document. And I guess it's worth saying that they've been sort of set in the context of trying to balance affordability, including affordability over time, with ensuring that these homes are something that stacks up financially for developers to deliver. And there is also a kind of framework of existing policies that the Mayor has taken into account in thinking about where rent levels for these homes should sit. And those include the London Plan. I've already talked about that a bit. Also the National Planning Policy Framework that requires that rents for intermediate housing should be at least 20% below market levels. And the Mayor is clear that he prefers it if they're at a greater discount to market rent. And then finally, where registered providers are developing these homes, there's a consideration of the Regulator of Social Housing's rent standard, which says that generally they should charge social rent levels or affordable rent levels for housing, unless it's a type of housing that's exempt from that requirement. And the Mayor anticipates that these homes, as intermediate homes for key workers, would be exempt from that requirement. So the rents wouldn't need to be at the levels of social rented housing. So just to be a bit more specific, the consultation document proposes some benchmark rent, so sort of maximum rent and service charge levels for these homes. And the starting point for setting those is, as the manifesto commitment said, key workers' incomes, and specifically the potential kind of rent levels for 3 and 4 bedroom homes are set at 40% of key workers' average net household incomes. And then the potential rents shown on that screen for 1 and 2 bedroom homes are set at a bit less than that. And then the consultation document goes on to talk about the option of, rather than just having a single kind of London-wide set of rent benchmarks, extrapolating some borough level benchmarks from those. And then, and so this is becoming a bit more involved, but capping those benchmarks at 70% of market rent if the benchmarks exceed that, and also at that amount that I talked about of currently £1,563 a month. So the maximum amount that the London Plan allows to be charged for intermediate rent if the kind of calculation in a particular borough yields rents that exceed that amount. The consultation also asks about whether these benchmarks should just apply when a home is first let, or whether they should also apply if it's a relet. It asks for views on rent increases and proposes 2 options. So increasing rents in line with wages, which obviously has some sort of advantages in terms of ensuring affordability, or increase them in line with CPI plus 1%, which is kind of a fairly familiar measure on what the government's proposing for social rented housing over the next 10 years. So the consultation asks for views on those options. It also talks a bit about tenancies and management, and we're in a slightly kind of uncertain place at the moment because, as you may well be aware, the government is taking through Parliament some legislation to change the tenancy framework and to end short-hold tenancies. So the Mayor has sort of set out what he anticipates providers, what tenancies he anticipates providers would use for letting those homes, given what we know at the moment. And he's also said that his kind of intention is that these homes should provide secure accommodation for tenants. So the tenancies wouldn't be dependent on tenants remaining key workers or retaining an income that's below that sort of maximum level at which London plans as households can get intermediate rented homes. He's also keen for there to be an option for these homes to be let to households of sharers as a single household. And he asked for kind of insights on those from the point of view of housing management. So really key area covered by the consultation, funding and viability. The Mayor makes clear that he would like to fund development of key worker living rent homes through his affordable homes programme. There was also clear that what he is able to do through a future affordable homes programme will be subject to agreement with the government. And he recognises that these homes will probably cost more to develop than shared ownership or London living rent homes because providers don't get a kind of big chunk of income when someone buys a share of the home. So he asked providers for sort of thoughts on what amount of grant they might need in order to make these homes stack up. And he also asked other potential developers and providers about what they would be taking into account in kind of making assessments of the cost and viability of developing these homes. And then the consultation also covers the question of the relationship between these homes and London Living Rent, which at the moment is one of the Mayor's preferred affordable housing tenures. And it's still a relatively young tenure in that the expectation is that providers sell London Living Rent homes on a shared ownership basis after 10 years. And we haven't actually yet got to the point where it's 10 years since a London Living Rent home has been completed. So it's kind of still relatively early days for London Living Rent homes. And I guess the Mayor is asking, should these homes coexist alongside London Living Rent homes, or should key worker living rent homes, which are for this long-term rent, should they become the main form of intermediate rented home he supports? And then the sort of final area that's covered by the key worker living rent homes consultation is something Rachel mentions about equalities impacts. And the document sets out sort of some data that the Mayor has already got on key workers, but it asks for insights on those who would be eligible for these homes, particularly in relation to their demographics and what the Equality Act classifies as their protected characteristics, so that the Mayor can review the proposals he's making with those different potential impacts in mind, and if it's appropriate, kind of review the proposals to ensure that there aren't sort of adverse impacts on particular groups of Londoners. So that was attempt at a whistle-stop tour through what the consultation document covers and some of the things it's keen to find out about. And yeah, I think really keen to kind of use time now to do my best, potentially with Rachel, to answer questions that you've got, but also to kind of hear thoughts and reactions.
Thanks, Deborah. That's really helpful. There is a question in the chat from Mary Manuel asking about what analysis of the key worker occupations and the salary ranges have been taken into account for the intermediate. How, in fact, Mary's got her hand up, so she can do a better job of asking her question than I can, I'm sure.
Hi.
Yeah, thanks very much, and thanks for that sort of overview. I think, and I'm sure you'll hear this from the sort of other people you're consulting, you know, it was just really who's already being needs are being met, and just thinking that up to 67k, you know, it's quite high, and there'll be others who know better where the NHS need fits most. But if we're talking about, I think it's a third of Londoners are classed as key workers. You know, where's the need? If we're talking about healthcare assistance, we're talking about band 5, then looking at those affordability, I think on the 1-2 bed, it's more than 40%. So that was just a concern around that, and whether, you know, the scope for that ceiling of 67 to be brought down, because if those people are already able to access the intermediate housing, because you can see that from an deliverability, you know, the intention will be sort of it will be going for the higher levels, and then the people at the lower levels won't access it, and they won't be able to access social housing. So I suppose from that equity point of view, and just that's my main concern around that. And I didn't know the timescale for 6,000 homes. Is that during the sort of the rest of the mayor's term, or? No, because if you talk about relatively small, how do you target at the people most in need for delivering London's services, really? Thanks.
Sure. Yeah, so very good question about the time frame for the 6,000 homes. The manifesto didn't actually specify a time frame, but we're working on the basis of those homes being started by 2030, which, I mean, sounds a long time off, but I think, as I'm sure you're aware, in terms of kind of delivering homes is not necessarily a massively long time. So that's the time frame. I think on that issue of incomes, I mean, it is a really tricky one in that there's this kind of perennial tension between making sure homes are affordable to those for whom they're intended, but also making sure they can get delivered. So 67,000 is the kind of upper limit of household income at which households are eligible for intermediate rent. But the mayor is definitely not sort of anticipating that these homes should only be developed at rent levels that are affordable to households with an income of 67,000. So the London plan is clear that that homes should be developed that are affordable to households with a range of incomes below that level. And I think also recognises that some key workers have incomes where they do really need social rent. Now, I say that kind of slightly cautiously, in that I recognise that someone needing social rent doesn't necessarily mean in the current climate that is what they will get, although the mayor is working hard to increase delivery of social rent, as well as committed to delivery of these key worker living rent homes. And then in questions of kind of how we have analysed incomes, the kind of the dogged may have got the appendix in the consultation document, which sets out which incomes we looked at and the data sources for those. So yeah, the proposals for where rent's set isn't just based on the 67,000. It is based on looking at actual key workers' incomes. But yeah, I do kind of hear what you're saying about the challenge for some key workers like healthcare assistants who are on lower incomes. I'm just seeing there are various questions in the chat, some of which I think are on similar points, but which I don't want to miss out. So I'm just going to have a quick look at those. So Rich does helpfully put the list of key workers in the chat, and Mary, you're right, that does cover about a third of
Deborah,
Londoners.
Do you want me to keep an eye on the chat, and I can just
that would be brilliant, actually.
Yeah. So it looks like the kind of the next sort of distinct question, and there's some someone's provided some helpful information that at Finchley Hospital there was an assessment of need done which identified band 5 and band 6 workers as part of the planning submission. I don't know if you want to say any more about that. I can't see the Howard who put that in the chat. That's fine. If you do, if you do, then just come back. But I've made a note of that. So then
Great.
the next question that was in there was from Ian Burden, which asks, is there an option under the equality section to also include accessible designs, bearing in mind disabilities or long-term health conditions?
Yeah, I mean, that's obviously a really important question. That is the whole issue of how homes are designed is something that is largely covered by the London Plan, and there is a whole sort of section of that relates to accessibility. And any new homes that are developed will, of course, have to be compliant with London Plan. So there should, by virtue of homes getting planning permission, be consideration of accessible design. So that isn't sort of something that we're looking at specifically in these proposals, but that's because there is already a policy that applies to ensuring that all new homes are affordable, rather than because it's not an important issue. Thanks, Rachel. Oh yeah, I can see there's a bit more detail about average salaries, which we will note down. And then it looks like there are hands from Jim and from Samantha. Jim, do you want to go next? Oh, I think you might be on mute.
I took my hand down and didn't put my microphone off. Sorry. Yeah, I thought I'd offer the Savills perspective on the question of incomes and affordability of rent, based on the housing need work that we've done across different parts of London, including the Finchley Memorial assessment of need that Howard Williams referenced. We look at the median income of those in need by household type, and so if you're looking at the discount required for the median income, you're not necessarily catching everybody, sort of picking up Mary's points, but you know, it's in the middle of the pack, and the median incomes are generally lower than the incomes that are in the consultation document. But on the other hand, the consultation numbers use a gross to net with regard to tax and NI take of 70%. But actually, if you look at the household incomes of the sort of households we're looking at here and go through the HMRC numbers, the gross to net is actually near 80%. Largely because of the tax-free thresholds, etc. So in fact, the rents the proposed rents are pretty much in the same ballpark as the sort of rents that we were coming up with in our recent work. So the one counteracts the other.
That's really helpful comment. Thank you. Samantha, should to come in.
Hello there. I'm Sam Wells. I work at Newmark. I'm a planning consultant. I actually used to work with Richard. Hi, Richard, at the GLA. I've sort of taken a bit of an interest in this because really from working at the GLA, it was talked about a lot. Sort of in the I was there sort of 2009 to 2018, but no schemes really came forward, and I can see reference to Finchley, which I wasn't aware of, but I'm just interested, I guess, to know, does it look like a duck and walk like a duck, i.e. is it affordable housing in terms of design and rent levels, or are we looking at a more of a bespoke response to the end user? So for instance, if it was NHS accommodation, are we having to do a bit of a hybrid of some, like not dormitory style, but sort of adult student housing, co-living where people have arrived as nurses from overseas and don't know anyone and want a bit more communal living? Or are we looking at actually homes for families so on one scheme, how would you design for all? Or are we sort of like, you might have a fire, someone who works in the fire brigade who needs a 2-bed home, but you might have nurses who have moved from sort of India who don't know anyone and are here for a year and need somewhere. So I'm just not sure if has the actual planning definition been looked at in terms of what we're talking about here, or are we just looking at intermediate housing in planning terms and it's sort of slotting in with permissions that are out there or being designed, or are we looking at a whole new type of product? I guess I suppose I'm probably talking at you, right, because it's swimming around in my head, and I did join late. I'm sorry. So you may have answered this. But if we're asked to say, oh, look, by Southwark Council, yeah, we're desperate for some key work housing. So at King's College, we've got Tommy's, we've got Guy's. We need key work housing for nurses. Do we know what we're designing? Telling architects to design, I suppose, is a question.
Yeah, no, I think that's a really, really helpful kind of thing to hone in on. So at the moment, what's set out in the consultation proposals is kind of intermediate housing, so self-contained homes for households. But there is a recognition that the mayor is keen to see those going to households who are, potentially groups of friends who are sharing. So not just necessarily for kind of what have perhaps been conventionally sort of recognised as households in planning terms or in housing need terms. So the consultation, I think, isn't really about the kind of co-living that you're talking about, but that isn't to say that there isn't kind of an important place for that. And some of the conversations that we're having at the moment with different providers are about scope for whether the mayor can potentially fund that. So at the moment, funding, you're probably aware, has gone to self-contained homes for households, but kind of a recognition that the kind of co-living model, particularly for, as you say, the example of people who have arrived in London, don't know anyone, can have real value.
Yeah, I guess because it's sort of, maybe I'm just a bit concerned about the practice note that the planning team issued on wiping out sort of intermediate housing if you've got more social housing, like the equivalency point, which John Watcher and his team have sort of with that practice note. And does that mean you're not going to get if everyone's going to now do more social housing to sort of deliver schemes which aren't viable, how are we going to address the intermediate need, I guess, which this is? So there's a lot flying around at the moment about schemes stacking up, and I suppose it's just with this in the mix, how do we prioritize this if we're told to prioritize social rent? I suppose.
Sure. Yeah, and I think so. Then the note you're referring to there is the the recently published planning
Yes,
and
yeah.
housing policy note that's published
Yeah.
in just before Christmas
Yeah.
on accelerating housing delivery. And that sort of says that the biggest need is for social rent and the biggest priority is therefore for social rent.
Yeah.
Yeah, I mean, I think, we shouldn't ignore the fact that that might potentially benefit some
Yeah.
key workers if developed at
Yeah.
large enough scale.
Okay.
But I totally am kind of sympathetic to that feeling of like, everything's a priority and there's lots of shifting ground. And I think, this is an incredibly kind of challenging context to work in because, we've got a new government and kind of lots of policy change that hasn't necessarily yet kind of all fully landed. And then also a very kind of uncertain housing market and rising construction costs. So, I think it's a really difficult time. And I guess one thing I would say is that accelerating housing delivery practice note is particularly about how can we keep housing delivery going in this context. So what it's saying is that some of the measures that are set out there are meant to kind of sustain delivery for now in this challenging context. So they're not necessarily long-term kind of, the GLA suggests that people do this forever to get delivery of affordable homes. And I mean, I think on that point about, if social rent is the priority, how is intermediate rent going to get delivered? I mean, I think what we'll say is that, current planning policy is kind of clear that there is a need for intermediate housing, and then local authorities, local plans are typically clear on that. And I don't think that is going to be kind of entirely sort of done away with by an assertion that there is a huge need for social rent and that's where the greatest need lies. And then I would also say that sort of looking ahead, my colleague James Gleeson is working on a strategic housing market assessment at the moment, which will inform a new London plan. And I think it's very likely that that will find a significant need for intermediate housing.
Yeah, from my perspective, obviously, as a planning consultant, if you could, but I guess in the same way, student housing, if you've got a higher education institution on board, it sort of helps with the planning process in terms of direct lets. But I just wonder, is the ideal scenario that a developer would partner up with a key worker provider to deliver affordable homes alongside their private development? Is that sort of the vision, or
I think it's part,
or would it just be they package it up and then sell it a bit like they would to an RP? I mean,
I think it's part of the vision, and I think it's part of the vision on which the mayor is really kind of keen to hear insights from organisations represented on this call. So the mayor is really keen that organisations that employ key workers, that are kind of representing, that are seeking to secure housing for them, like for example NHS trusts, will deliver this kind of housing. But he also recognises that it might be something that a council or a housing association just decides to develop as part of its affordable housing kind of offer, or that it's something that's secured through planning agreements. So a build to rent developer, for example, would be subject to an obligation to provide some affordable housing, and that's part of that might be this kind of housing. So I think the sort of partly a pragmatic recognition that there will be, within this overall umbrella of key worker living rent homes, that will come from various sources, and I think slightly will need
is it
to,
one
probably.
person one person pocket style? Is it 2 beds because they're can't afford to live in London as a family? I suppose it's just, there's lots of different sort of scenarios in terms of the housing type, which might not get worked into a
Yeah.
a BTR scheme, for instance, I suppose. But yeah, I've probably
Yeah.
taken up too much time. I've probably got lots of questions.
I was about to
Thank
move us
you.
on, Sam, but thank you.
Yeah.
That was helpful.
Thanks, Richard. Sorry about that.
No
Oh,
problem. We're going to run out of time. We've got lots of hands up,
sorry.
so we'll get them
Yeah.
up. But no, that's all useful.
Thank you.
Yeah,
Sarah,
and
you're next,
just
I
on
think.
the lots of hands, just to say, if you know, I'll put my email address in the chat, and if there are questions and comments that we don't get to, really kind of happy to chat to people or exchange emails with them after this session.
There are a couple of questions in the chat, but maybe I'll just note those down because there are also people that have had their hand up. But if we have time, I'll go to the ones in the chat. But otherwise, don't worry, I've got them noted down.
Right.
Okay, Richard. So just Deborah, I'm Sarah Horden. I chair the NHS Homes Alliance. I'm vice chair at Oxford University Hospital, so not part of your London scene. But I think the themes that we're seeing, and just in response to Sam's question about, you know, what the need is that it is it varies from trust to trust. But I think it's a mistake to think of it's nurses' accommodation, it's all cluster flats. We see a lot of particularly band 5-6 nurses looking to, even if they're international, a lot of the international nurses are looking to come and then longer term bring their family. So family housing is important, but I think the key message is actually about engaging with trusts in the local area or other key worker organisations to actually understand what the need is. And I think, Richard, we're doing some work through the Homes Alliance and some of the projects to pull together the research that Savills have done, but there's also, and I'm not sure if she's on the call yet, but Jess Haynes has led Lewisham and Greenwich is leading a piece of research with UCL, and the draft report was published last week, 3 weeks ago, which we should link you in, which has got some really good data around that trust and what the housing need is for that trust and the type of people that are looking for homes. So I think actually pulling together and trying to work out how we bring the trusts, really the chief people officers, you know, who are the key people that they are looking to recruit and retain, and what are the characteristics of those people, and doing the staff surveys and the focus groups. We've got some good data from Oxford, which is Oxford, not London, but would be similar. So I think it's about bringing it together. Also, Sandra's not here, but Price Hubble have got some really interesting data sets and has done some work around NHS. They can map rents, and she is here, so I'm going to let her explain what she does. And another theme that we've been picking up is around personalised rents, and actually with open banking, the ability to think about how your rent might change as your income changes over time. So that piece around, there's a question in the chat about if you allow people to stay, don't they get stuck? But I think if the rent goes up, if there's a way of mapping rents against your income, that potentially then frees opportunity for subsidised rents, either in other areas of the same block or in other areas of a development by a developer. So there's some interesting stuff that technology is allowing us to start to access. And Dolphin Living, who are a Westminster charity, do some really interesting work on personalised rents. So I'm going to hand over. Richard, I don't know if you just want to go to Sandra to let her pick up the theme that I've just introduced, and then we go to Peter.
Yeah, we've got just about enough time, I think. So sorry, Peter, we will get to you in a moment.
Okay, so very briefly, thanks, Sarah. The report that the interim report that was published by UCL for the Lewisham and Greenwich Trust, as Sarah said a couple of weeks ago, that we were introduced to UCL at that point, and we've now submitted analysis for that report, which will then be incorporated. So we hold a very large database on renters with rents achieved, and we also know for all the renters, we know what they earn, where they work, you know, what's their employment. So we're able to filter out those employed in the NHS and have a look at, of those who are in the private rental sector, what are they paying in rent and what are they earning? So we can do really fine-grained analysis on having a look at which NHS renters are able to access the private rental market, what is their affordability ratio, and then also to look at the hypothetical, those knowing what we know about achieved rents, how does that relate to the pay bands, so we can see who is theoretically excluded from the private rental sector. But all that is going into the report that UCL are doing with Lewisham and Greenwich Trust. Thank you.
Right, it's really useful to know. I'm definitely keen to see any data that people are able to share. We'll go to Peter.
Yes, thanks. I a bit like Samantha, I'm just in my head, I'm just going around my head what's going on. So I'm a sort of a development manager working for the Royal Free London, so a NHS trust based in North London. We do have a lot of units that were built a long time ago. We run with a huge desire for more, and I suppose I can see from the discussion so far, I can see how RPs will be interested in this and that they can get grant funding to tackle the viability conundrum. I suppose I'm just open question. Does this in any way benefit a sort of a landowner employer, so a trust which has land, is always looking at how it can develop it, would like as part of any development, whether that's development to increase the health facilities or maybe to, again, do some enabling, selling a bit to get some housing to help fund, we always want to do as part of that, do some key worker housing, but again, the viability is always it's always very challenging. So, and we don't just want to bring an RP in who under this sort of banner would then potentially, would the housing then be for our staff? And these are typically on our site, so we'd want it to be dedicated for our staff to help solve a big problem. So yeah, just really an open question, how this would or wouldn't benefit landowners / employers like a trust.
Yeah, and I think the intention is very much that this could be part of housing developed on land that was, either released for development or kind of retained by NHS trusts and other landowner employers, and that that might mean working with an RP, which would have the advantage of that RP being able to get grant, but it wouldn't necessarily have to do that.
Okay, thanks. We'll very much. We've got a accommodation team, I think, on the call as well. So we'll go away and look at the information provided and try and give some feedback on that. And maybe I noticed Ian's got his hand up, who is heavily involved in this as well. So I'm sure Ian might also add some further insight.
Hi, Ian. Do you want to come in?
Hello. I thank you, Peter, but I'm not sure that much more insight. There's so many good people on the meeting, but I was actually going to go back it slightly, if it's okay, to something that Sarah said, which is absolutely true. I agree with what she said about having that tailored rent levels. But as Lester Wagman has put in the chat, I think there is a point that's when you did your presentation, Deborah, around how do we get people to move on from the accommodation?
Yeah,
and that plays into Peter's point. We've got a recruitment issue and a retention issue. So we can't just have cluster flats, because people don't want cluster flats unless you're a student. Lots of our staff are no longer students. But if someone joins and is a key worker for 6 months, they secure a flat at a lower price, they could in fact still remain on the same salary level. They may not increase their salary, but they are no longer a key worker. How do we ensure that those units remain available for the key workers? Because otherwise we just have a lot of people who are say cleaners. So a cleaner for the NHS, okay, great. But then how do we then make sure that there's a trigger that moves them on? But we need to bear in mind that there's a lot of research. There was a longitudinal study a few years ago which showed that people's stress levels increase dramatically when they're in rental accommodation, because of the amount of stress they're under at the thought of being thrown out of their accommodation. So absolutely agree, there has to be a transition. How do we set that transition period? Is it 6 months if you're no longer a key worker, or 3 months, and you're given provision to time to move out? But there does need to be something, I think.
Okay. That I think this is sort of a comment that we have heard at various points in the consultation, and I know the Deputy Mayor for Housing has a strong preference for these homes not having kind of conditional tenancies. But yeah, equally recognise there are providers who are seeking to develop homes where people are asked and expected to move on when they're not key workers, and there might be some lessons to learn from London Living Rent, where the expectation is that tenants kind of save towards a deposit with a view to buying, and that there is kind of scope to move people on if they're not kind of doing that for all sorts of different reasons, and that does kind of work with them to identify what might be suitable options for them. Stuart, I think there was a hand from Anisha, but then I think Anisha's hand went down. I just want to make sure that wasn't accidental.
Yeah, I think that was accidental. Apologies, people. Sorry.
Okay, given the time, we'll probably wrap up in a moment. So I was just going to make just one quick point on that, which is Deborah will know better than I do, but obviously at the point when people do move on, you can ensure relets are done to people in the NHS via some sort of process about, that each letting gets the prioritisation. There is an issue about how you manage the people moving on, and obviously some of that, as Deborah's mentioned, is tied to the kind of government policy stuff that's going on about assured short hold tenancies and other options that can be used as a kind of controlling factor in some of that. So some of that will have to play out, but yeah, it would be useful to try and get some idea about how people can be encouraged to move on rather than thrown out and maybe a period of grace or something. But yeah, if anybody has suggestions, I'm sure they'd be very welcome, and I'll go away and think about that too. But yeah, ideally we know that once people move on from employment where you're especially in a retention situation where people are not being retained, but it can be some of the people benefiting from the outcome that could be challenging. But yeah, certainly something to take away with us. So just quickly wrapping up with Deborah's stuff. Mary Manuel has put in the chat that she will be doing a response and is keen for people to feed back to her in the next couple of weeks. I think it's about 10 days. In addition to that, Mary, if you could then share that with at least Sarah and I and John at the Royal College of Nurses, I'll send you his details. And if other health and care stakeholders want to respond and kind of system responses, then let me know, and we can just make sure that we've shared the kind of those pieces. Deborah, hopefully you can get things from this session, but also happy to share the kind of comments in terms of you putting your internal piece together. And obviously we'd like to thank you for your time. It's been very helpful. I think you were suggesting at the start we might not fill all of your time, and we did that comfortably and probably could have gone on. So thank you, and Rachel, very much for doing that and for coming and speaking to everybody. We greatly appreciate that, and I understand that you've got to drop off, so I thought I'd get that in before you go. And thanks for including the email address for the responses. That's great. We're now passing on to Jess Haynes, who is just going to give us a run through for those especially who missed it in January about the work that UCL are doing on their reporting linked to Lewisham Greenwich Trust. I'll let Jess talk more about that in the last 10 minutes or so.
Thanks, Richard, and good afternoon, everyone. Lovely to see you all. So yeah, I mean, it's already been mentioned in the context of the various pieces of research that have been undertaken to understand the key worker need. I suppose at the Trust we decided to go down the academic route because we thought there was so much evidence and research that had concentrated on the commercial side of the transaction. One of the big things that we needed to do was provide something that provided the evidence really to trust boards in order to get those decisions made. So a lot of this is around, understanding what the relationship is between the delivery of key worker housing and how that directly impacts on the trust. So to give you a bit of an insight into the report that was produced by UCL, which is an interim report, because we held an event in early January, which is just mentioned. So 85% of our respondents said that they would seek employment elsewhere away from the trust due to issues with housing affordability. Now, that's a real kind of headline hitter for us, because obviously recruitment and retention of our workforce is absolutely fundamental to us being able to sustain, a good quality service and keep functions and running in this part of London. So that's a bit of an attention grabber, I suppose, sadly. And tells us really that there are some significant underlying issues, and they did come out through the survey responses. So as already mentioned as well, I think that we had a couple of focus groups as well, where we actually met with staff, we met with key workers and listened and tried to understand more about what it was like on the ground as such, what people's experiences were. And poor quality landlords, poor quality accommodation, kind of sustained issues with accommodation was a key one that came up time and time again. And then a lot of the narrative, the supporting the research and the statistics, that's what came through. Also on the kind of, again, on the stats though, 50% of our respondents were spending over 40% of their earnings on housing, which, as a lot of us will know as housing people, that's really not a good indicator, and that shows that people are in a situation of what they call housing stress. So the UCL report touches on that. As Sandra's said, we're really, really grateful actually to get that data from Price Bubble, because what UCL are going to be doing now is taking the interim report, taking the feedback from the summits that we held in early January at UCL, and that data, and then producing a final report, which will be delving into some of these issues in more detail, using that data and analysis to kind of unfold or make some rounded recommendations on what we might be able to do, or where the main issues are and what some of the solutions to those issues might be. So expecting that report, that final report in the coming weeks. We've also had a lot of activity since the summit from other trusts. So I think that I think my colleagues on this call will be really glad to hear this. I think we're going to be building that evidence base even further from not just Lewisham and Greenwich. I think UCL have been contacted by other trusts within my neighbourhoods as well that are interested in doing a similar exercise, so going out to their workforce and asking those questions. So we're very gladly, Deborah, provide all this evidence to the Mayor's consultation process and key worker housing, and we're hopeful that it will help to kind of formulate and make some decisions on those final policy points. So watch this space in terms of that final report in the coming weeks. We'll share that through the NHS Homes Alliance and through Richard and Co. So totally open, transparent. It's evidence and research for all. That's how we see it. May have been undertaken at Lewisham and Greenwich, but it's for the NHS. It's for all of us essentially. So yeah, I'll stop there. I think I've covered most of the key points, but yeah, any questions, give me a shout.
Thanks, Jess. And do we have is that available yet? Sorry, in terms of publicly available?
Most certainly, I'm more than happy if we want to circulate the interim report. Yeah, more than happy to do so, and yeah, we'll do so with the final as well. Yeah, so publicly available.
Yeah, brilliant. I think obviously this kind of work and the ability to demonstrate the kind of evidence of need and the requirements is always very valuable, especially where we move on from the anecdotal. I think most people in the system realise that there's need, but in terms of turning that into something evidence-based and with kind of clarity about what it is we're trying to achieve and what people need to help to both enhance their lives, but also provide the services is very useful. So thank you for that. Yeah, I think unless anybody else has got any other questions, we'll wrap up and you can have a couple of minutes back. I think we're due to finish at 12:15. I will leave you with a few thanks. So thanks to Sarah and Hattie at the Alliance for doing all the hard work in the background and letting me chair. Thanks to Deborah and Rachel for their work and coming today, and thanks to Jess for updating us on the UCL work and agreeing to share with us so that we can all see more in terms of work in the space. And I'll pass over to Sarah.
Thanks, Richard, and thanks everyone for attending. I think the fact we've got 70 people turning up to hear this conversation shows how important it is. Just one thing, on NHS Homes Alliance website, we're just about to launch a resources page. So we've got Savills have offered to share some of their data and research that's in the public domain. Anything else that people would like to share, we're very happy to put it up there as a way of hosting. So I think we'll put the UCL research up, but any other staff surveys, things that people are happy to share, I think the more that we can pull this conversation together, the better chance we've got, both in terms of the conversation around housing policy in London, but also actually in terms of investors, in terms of demonstrating what is required and that there is a big market here and there's an opportunity effectively to create almost a new tenure in the same way we have PBSA, but a key worker piece, which would sit very nicely alongside the mayor's policy. So yeah, the more we do together, the better chance we've got of making this happen.
Anisha's got a hand up.
Just a quick one. Has there been, I might have missed this, a roundtable discussion with funders and investors to understand what that probably has already gone on?
We had one with the Good Economy back last February, and I can share the details that came out of that. And we've got quite a lot of investors. There's a real appetite from different scale, and some really interesting things about that maybe we pick up offline. But effectively, if we're collecting data, if we could collect the information about length of tenure and also default rates on rents, I think might be two really important pieces of data to start to sharpen the yields.
Yeah, because I was just wondering, I mean, obviously Savills, it sounds like they're involved, but is there a way in which the NHS Trust can build the data in such a way that it's attractive to the investor in a
that's exactly
way? Yeah, what you're getting at. Yeah. Great, thank you.
Sorry, Richard, we will actually let you wind up.
Sorry.
That's it. I think that's it from everybody. Thank you all for your time. And obviously, yeah, feel free to reach out to anybody who you've spoken to today that would be useful. Oh, Brian, you've got your hand up.
Just wanted to know, is there a minimum number of units developers that you've had engagement with are willing to do, or is it a max, minimum? Which is it?
So I think to get the really big guys involved, so the key for viability is to get the cost of capital down, to unlock that really lower cost capital, at least having a standard form set of contracts that they can look at once and then deploy capital. Those would be quite big schemes. But what was interesting in the Good Economy roundtable was that there are smaller investors, particularly local investors, who would look at smaller schemes. And again, if we had a standard form approach for some of this, then actually, picking up 25 to 50 units for some of those smaller investors, particularly local place-based investors. So place-based impact investing, there's definitely interest in those smaller schemes.
Thank you all very much for your time, and hopefully the recording will be on the NHS Homes Alliance website in the near future.
Yeah.
Thank you.
Great. Thanks, Richard.
Thank you.